Hi, my name is Tim Miller. I'm a state representative in Minnesota, and welcome to my show, Legisplaining. What we're going to do through this webcast is help you understand how your government works. We want to make it plain and simple. I'm going to use very real-world things that I'm working on in St. Paul, which is the capital here in Minnesota, and to explain how things work, some complex issues perhaps made a little bit more relevant to your life. So welcome. I look forward to hearing from you on this episode and for many episodes to come here in the future. Tonight we're going to talk about probably one of the biggest issues in government right now, and it affects everyone, no matter what your social class is, what part of the United States you're living in. My district is in rural Minnesota, and we certainly are having challenges with this, and that's healthcare. Now, healthcare is a very big word. It has a lot of different components to it. It means different things to different people. Healthcare may mean what exactly, where do I go to my doctor? That's my healthcare. It may mean your insurance. A lot of people talk about insurance, or they say healthcare, but they really mean their insurance. And this has grown over the years. Before we brought in the Affordable Care Act, Obamacare, we certainly had some challenges. I'm a free market person. I can tell you that health insurance has not been free market pretty much my entire life. It's been heavily regulated by the federal government, and then under the Affordable Care Act, they became very regulated. And that's created some problems. Here in Minnesota, we put an extra layer on that when they brought in Obamacare. They allowed for certain states to have their own exchange. We were one of about 7 or 8 states that started our own exchange. It was called MNsure. That began in 2012, I believe. And since that time, all other states except for us and I believe one other state have gotten rid of the state exchange because it's very expensive. It doesn't work. It didn't help. If you remember, the whole point of Affordable Care Act is you can keep your doctor and it'll save you money over time. Well, here in Minnesota, you lost your doctor, particularly in the individual market, and the prices skyrocketed. Out in rural Minnesota, well, in the whole state of Minnesota, the individual market comprises about 5 to 6% of those that are insured. And in greater Minnesota, that's about 80%. We have lots of farmers, small businesses, we just don't have the big corporations. And so most people are on an individual market. And a few years ago, that collapsed. That collapsed a lot to do with how they did MNsure. They were putting a lot of bad expensive healthcare issues into that market, and it just basically caused it to collapse. And so we've been dealing with that with the last couple of years. What I want to talk tonight about is a very specific issue related to that. And if you've never heard of it before, maybe you have, but there's a term called reinsurance. Now, that term too can mean different things to different people. But what reinsurance basically is, very simply put, is it is insurance on your insurance. And it's a way to control the costs of what's going on because you don't know how expensive things are going to get. And so an insurance company minimizes their risk by putting what might be called stop loss, which is technically the insurance on that insurance. If it gets too expensive, that insurance kicks in. Or here, oftentimes with government, we do something that's called reinsurance. Now, a couple of years ago when the individual market collapsed, here's what it looked like in the individual market for people. Your monthly premiums would go for a typical family of 4. Let's say you're 35, 40 years old, family of 4. Your monthly premiums were up to about anywhere from $1,500 to $2,500 a month. And oh, by the way, that included a deductible of an individual deductible of $7,000 up to $13,000, $14,000 for the family. So before insurance even paid for anything, you were paying $30,000, $35,000 out of pocket yourself before insurance paid a single penny. And if you remember, under the Affordable Care Act up until this last year, you were required to have something. Another thing that happened in Minnesota is the different insurance plans, the companies, left the market one by one. And when it collapsed, it was down to just Blue Cross Blue Shield, and they pulled out their normal program and brought in what was called Blue Plus here in Minnesota. It's a very limited program. It also, in Minnesota, most, you have your local doctor, but then your specialized care kind of moved towards the University of Minnesota or down to the Mayo Clinic. Of course, we have the Mayo Clinic down in Rochester, which is a wonderful place to be able to go. And what it did was it shifted everyone in the individual market out by us and moved us out to South Dakota in the Sanford Hospital program, which they have very good services, but it's a lot longer distance away. There's not as many clinics in that group and in that service area, and that created all sorts of problems for some people. So we're facing a lot of problems, and legislation was being proposed that were policy changes, that were a lot of free market policy changes that would be really good. Now understand also, when we're talking about these markets, the federal government has a lot of work to do, and frankly, they've dropped the ball. They've been very nervous about doing things because a lot of the things they have to do are going to kind of create some rough spots for some people, but in the end will be healthy. It's kind of, think of it literally like taking some medicine. The medicine isn't real great, but it's moving you in the right direction. We're going to have to do that. But because of this problem in Minnesota, and I want to give you an example of a story to make my point. I had lots of stories like this. This one really hit me the hardest. There was a woman who called me from my district and said, we're going to be losing our insurance that we've had for the past 25 years at the end of the year. This would have been at the end of 2017. We're going to be losing December 31st our insurance. My husband has throat cancer, and he received surgery down at the Mayo Clinic, and he's now getting chemotherapy. Now, when he had his surgery to remove the cancer, they removed about 60% of the muscles in his neck and into his tongue, and they replaced it with muscles from his abdomen. And so not only is he under chemotherapy, but he's having physical therapy. He is also, stitches and all these things you can imagine. That's pretty serious stuff. And we're told that he's going to lose.
Past and past participle of tell one.
Sorry, some of the early parts of recording, you have Siri calling up and asking you questions. So sorry, apologize for that. So she's saying he's no longer going to be able to go to Mayo Clinic. And they said, with all of his specialists, we're going to have to find new specialists. And they said, by the way, this chemotherapy that he's taking is pretty specialized. And the only other place you're going to be able to get it is from the University of Iowa down in Iowa City, or in the University of Wisconsin-Madison, which is, of course, not only a long drive, but they said, by the way, your insurance doesn't cover it, and it's going to be $30,000 a month. She said, please tell me this is not happening, because my husband's going to die if this happens. Folks, the reality is that's exactly what was happening. Their story was very real. And I went back to the Capitol and said, we have to do something, and we have to do something now. And really, as we went forward in legislation that year, we had a very short-term thing that we did, medium-term, long-term, okay? And we need all three of those. Back then, we had to fix something right away, and we did some of those things. The medium-term thing, I said in the beginning of this, I want to talk about reinsurance. The medium thing that we did was we put in reinsurance, and I'm going to explain that to you here in a moment. But then you do the medium-term thing to fix the problem and stabilize the market, and then you do the free market, very real policy changes that are necessary to get our health care, meaning going to your doctor, getting the medicines that you need, getting the services that you need, affordable, accessible, and in a way that makes sense for everybody. So what we had to do is, again, the costs were exploding. The costs were going all over the place, and we had to control those. So what the state of Minnesota did is we took, it was about $350 million out of what's called the Healthcare Access Fund. I won't go into that now because I want you to understand your government, and I start throwing too many things at you, I'd lose you. In the future, we might be drawing things behind me or something like that. But the way that we were going to stabilize it was reinsurance basically acts like this. Anything costing healthcare of $0 to $50,000, the insurance company and the patient pay that portion. Now, if you have a $7,000 deductible, you get that first $7,000, and then the insurance company takes the next $43,000. Then what happens after that, at $50,000, it triggers this reinsurance. State of Minnesota is basically going to pay that bill between $50,000 and $250,000. We're just paying the bill on that. And then what happens if it's more expensive than $250,000? That stop loss insurance the insurance companies have, and that pays for it up and above over that. So as you might imagine, this stabilizes the market because the cost between $50,000 and $250,000, the plans aren't paying. The state of Minnesota is. You, the taxpayer, are paying for this if you live in Minnesota. I didn't really like this plan because really we're just kind of paying down the cost of things, and that's not a fix. That's just taking care of the current and present problem. But I voted for it, and I supported it because, first of all, it took care of people like that family I'm talking about so they can get insurance in the future. A lot of small businesses around me, they're able to afford insurance. And guess what? The prices did go down a little bit, by on average about 20% on premiums. So that did that trick, okay? But over the last 2 years, we haven't passed anything as far as policy goes to fix the true problems with healthcare. What are the true problems with healthcare? We have problems with pharmaceuticals. We have problems with how insurance plans relate to providers, the doctors, and who you have to go to, how you have to go to, many different things which would make it more affordable. We didn't do any of that stuff. Well, lo and behold, we're running out of that reinsurance money. So guess what's going to happen? The rates are going to go back up. And the insurance plans are telling us they're going to go back up. So they want us to come back with this reinsurance money. They want us to pour more money into it. Now think of it as like a boat, okay? And a boat that has a bilge pump. It pumps the water out. You know, you're driving around. If you're in a boat in a lake in Minnesota and you're driving around, you just get water splashing in. Maybe there's rainwater from the night before. Bilge pump pumps that water out. Now let's say that boat has a big hole in the bottom of it. And that bilge pump slows down the amount of water or even takes out the water that's coming into the boat. As soon as you turn off that bilge pump, guess what happens? The water comes in and the boat sinks, right? Now, you can get a bilge pump, you can get a new one, you can put a bigger one in and keep that water out, or you could fix that hole in the boat. I was willing to put the reinsurance in there 2 years ago so we could fix that hole in the boat, and we did nothing. We couldn't get people to agree on things. We had a governor who just, what he really wants is single payer. We can talk about that in another episode. And he doesn't care if this individual market collapses. But that's hurting real people, isn't it? So we've done nothing to fix that hole in the boat. And now they're coming back and saying we need more money for that reinsurance. We need to put a bigger pump in. We need the pump to run a little bit longer. Well, folks, I could not support that without common sense policy changes. I encourage you, if you don't live in Minnesota, your state is somewhere else in the spectrum. It may be real bad. It might not be so bad. But I want to give you another example to understand the way we're dealing with this. Okay? Reinsurance doesn't fix the problem. It only holds off the inevitable. And one of the things that bothers me is when we talk about, remember how I said healthcare can mean a lot of things to different people? Well, for a lot of people, healthcare means your insurance plan. What am I paying per month, right? Well, in my past life when I was younger, when I was younger, I used to sell used cars. I used to do a lot of different things. We'll talk about some of my different jobs growing up, but whatever you can do to pay the bills, right? I actually enjoyed selling cars. But in the used car market, what most dealers do is they come to you, and what's the first question they ask before you even say what you want? What do you want your monthly payments to be? Now, why do they say that? Well, because saying, how much can you afford isn't necessarily a great question, because how much you can afford is probably less than if they can amortize that off out of payments. So they will say, how much do you want your monthly payments be? And they do all sorts of numbers. They ask some questions about your income and stuff. Remind you, this is probably before you even looked at a car. But they don't want to show you a car until they know how much you can afford. So you give them some maybe income numbers, some other debts, and they say, based on our calculations, you can afford $350 a month. And you're like, wow, I didn't think I can afford that much. I was coming in here thinking I can only afford $175 a month. Oh, no. You wouldn't like any of the cars that are in price range. If you can afford $350, we'll find a way to make it work for you. Or, oh, here's what they'll also say. Oh, you want it to be down to $175 a month? Well, we can make that work for you. Now you're excited. Now you go out and look at cars. Now they dictate every car that you look at. They look at how much the car costs, how many years you're paying off on this, all those different factors based off of that original thing, what your monthly affordability is. What if the car that you can get for that money that you can afford doesn't suit you? What if you need a minivan and they want to show you a sedan? What if you really just need a compact car, but they talk you into getting an SUV? So my point being is that when we come with insurance and say, well, we need to bring down the monthly premiums, absolutely, that's part of it. Can we afford the monthly premiums on our insurance plan? But that insurance is only meant to mitigate the risk of the cost of you going to see the doctor or getting that procedure or getting your medications or whatever. So we need to change the dialogue in policy. We need to change the dialogue in our culture to say, what is it that we need? What are those services? And how do we make those affordable to the point that we can afford those in our families? That's what we need to do. And my problem with the argument here in Minnesota with this legislation on reinsurance is that it didn't deal with any of that. It was just like the cars. How much can you afford per month? Let's go in that direction. So I hope that was understandable. Hope I didn't ramble too much for my first show here. I would really welcome anyone that is watching this. Send questions about what I talked about. Something didn't make sense, let me know. If you'd like to see me talk about something, I'd like to see that as well. If you have critiques on how this show is going or ways to make it better, I certainly want to hear that as well. So I appreciate you tuning in this time. We will dive into a lot more difficult issues, more controversial issues than this. I do want to wrap up by saying is I want to make your government understandable to you, but I'm not going to do that by always throwing fireballs or getting you worked up or upset. I do think that there are some reasons that you should get worked up and you should get upset because your government is not working for you. And I think the less sense it makes to you, the more they try to pull things past you. So we're going to address some of those issues. Look forward to meeting with you again soon, and you have a great night. Thank you.